Dr. Sterling, you're muted.
Thank you so much, Dr. Lubin Johnson. And again, you really hit on some pretty critical points that I want to expand upon. The whole point here, folks, is that the United States is not just the managed care versus managed payment consideration. It's also, we don't have a healthcare system as much as we have a healthcare industry. And, the point to be made in this particular regard is that if you look at the healthcare outcomes, the United States ranks just about 37th amongst countries in the world in healthcare outcomes, even as we are number one by far, with 17% of the gross domestic product being spent on healthcare, compared to the second largest, which is French, with a much smaller number, 11% of that is only being spent. So we spend so much sustaining our economy through healthcare spending, which feeds hand into glove into the notion that from an economic standpoint, we really don't mind waiting until people to get sick so that we can do things to them, which actually generates commerce, which produces profits. The way that the rest of the world produces better healthcare outcomes than us, and remember, I'm talking about 36 different countries, is that they begin the conversation with health prevention and health promotion. An ounce of prevention has always been worth more than a pound of cure. And if the state of Illinois and the country in general is interested in producing better healthcare outcomes, then you begin the conversation by having a preventive health system in place, engaging in health promotion, and then supplementing those efforts when people do get sick with the type of robust apparatus that does exist here in the United States, and dealing with social influencers and determinants of health and all these other things. There would be a much more tremendous return on investment, better production of healthcare outcomes, and dare I say, even an opportunity to lower cost by doing things in this manner. And so, all the points that Dr. Lubin Johnson made are exactly on point, but let's never forget that if we jump into the conversation at the middle, which is the point in time in which people begin the process of illness as a point to where they should be beginning the conversation at the point in time of maximizing health, optimizing health, we like to say, stay ready, be ready so you don't have to get ready. Stay healthy so you don't have to get healthy. All right. So what I do want to do now, thank you again, Dr. Lubin Johnson. And
You're welcome.
Case in point, I always brag on her because she literally kept my mother alive for a full 8 years after a injury that had about a 95%, if that 99% likelihood of her dying immediately. So it was because of the way that she engaged in health promotion in advance of that she was prepared to make it those extra 8 years. So I don't do antidotes usually, but the point of the matter is very simple. An ounce of prevention is always worth more than a pound of cure. I'd like to transition to some innovation, because best practices are one thing, but there indeed are opportunities to be innovative in the way in which we approach health. And Arnold Prater actually is someone that knows this topic as well as anyone else, I would dare say, and wants to offer a few comments about some trends that are emerging nationally in the technological aspect of healthcare and in terms of the state and things that are applicable to this conversation. So welcome, Arnold.
Hold on. Oh, welcome. I guess I'm not on mute. Yeah, thank you for the invitation to participate and to talk about this broad topic. And thank you, Larry Ivory and Senator Kohler, for participating as well as the other participants. IT and information technology within healthcare is such a broad topic. It's virtually impossible, and to talk about those. And what's interesting is that information technology and IT, even though it's at the epicenter of all of the productivity improvements, all of the statistics that you heard, all of the improving healthcare outcomes, it's still not within the healthcare environment the service that's actually provided. So it's unintentionally neglected. And I'll try to explain what I mean by that, and then I'll try to get to trends that are happening within this space as it relates to data and artificial intelligence, and then also as it relates to security, things like that are really influencing this space. But before we get into future stuff, I think I need to talk just a little bit about IT and how it fits within healthcare at a broader phase. And my goal is really to show that it's virtually impossible not to include IT organizations in this process. So, and by that, I mean, the numbers that Marlo mentioned in terms of the spend and things like that, that was applied to minority vendors or vendors in general, or subcontractors in general. There's so many opportunities for participation in this space. It's impossible not to have an opportunity unless you did it on purpose. And that's probably what we're experiencing. So just in general, you know, healthcare information systems and IT include such a broad range of applications and products, you know, and there's a broad range of constituents from payers, patients, providers, provider organizations. And what you find is that IT is really, resources are really, you know, behind the scenes developing applications, building systems, interfaces, maintenance, maintaining networks, doing backup and recovery, you know, except I can go on forever. And what's really important is that this industry is lifted up by technology. And I know there's a few doctors on the call, and I don't want to, you know, get in your way. And I know you all are important, but you know, so is IT and IT resources in turn, and especially as you go forward in the future in terms of making decisions. And because of, and I'll show that because of the Internet of Things and all of the devices and what's been forced as it related to the pandemic and people doing things remotely, there's a new like volume of data that's being mined, that's available now, right now, that and being developed over time, that is going to have to be mined in order to help doctors and other practitioners to make decisions. And in addition to that, in some cases, artificial intelligence is going to be making those decisions for you. So so I'm just saying that in order to talk about trends at the same time, is that in this space, as it relates to jobs and job creations, things like that, there's going to be some artificial intelligence that is going to be taking advantage of a lot of the data that's created in order to assist in making decisions and as we go forward. So there'll be future opportunities as it relates to that. So I'll just try to go through and talk about some of the other things. Now, what's important in this healthcare space is that the implementation of technology didn't come easy. This industry really had to be incentivized over time. This started in the 1990s, and the implementation of HIPAA, which is the Health Insurance Portability and Accountability Act in 1996, was primarily introduced to focus on insurance and affordable, making healthcare focus on health insurance and affordable accessibility. However, it did include some additional provisions that related to administrative processes and also protection and security of health information. And that's the part that really started to bring the technology into the healthcare space. Now, things have evolved over time. There's other agencies, the other acts, high-tech, and they're introduced in 2009. And however, since 2010 to present, the Affordability Act and other things actually enhanced the high-tech act to include electronic health records through other incentives, and kind of force those who were not necessarily interested in the implementation of technology or this change, and kind of slowed it. So this industry really had to be incentivized heavily in order to adopt technology. But now it's here, and it's really taken hold and actually moving to the next level. there are two major categories of information systems within the hospital environment, and that's administrative and clinical. On the administrative side, this industry has been slightly ahead of the clinical side in terms of the implementation of technology. And you've noticed your enterprise applications and things like that that support human resources, billing, accounting, and other staff scheduling, things like that. However, on the clinical side, which was a little slower, which is now taking present, is very prevalent now, though. Those focus on things like the different departments within the hospital, radiology, pharmacy, laboratory, and other clinical decision support departments, and also included the implementation of the electronic health record systems. Now, the major issues that exist within the healthcare environment are primarily interoperability. Even today, after the implementations have gone so far, usability, and then health IT safety. As it relates to interoperability, that's obviously connecting health information systems, legacy systems, and new systems. Usability is, there was a certain amount of frustration, by users of technology over time that it's kind of waning, but it's still there. And then just health safety, as ensuring that, and this is not security, this is actual safety of technology as implemented within the healthcare environment. And not to, I don't want to bore everybody, but there's several key functions within the technology environment that cover operations and applications. And I've been in several industries, whether it's transportation, higher ed, during my time at Accenture. The functions of IT exist no matter how many staff you have, or how large your organization. There's going to be data centers, there's going to be networks that need to be managed. There's going to tremendous need for security, help desk, telecom. On the application side, you have business applications and clinical applications and websites. So, and I only mention those to show that there's such a broad range of opportunities for people to participate in this space. And now, given the advances and the tremendous amount of data that's being collected within the healthcare space for years, mining that data and presenting that data in a form that helps doctors and practitioners make decisions is a huge trend and a huge opportunity within the healthcare space. So that's pretty much all I have that's in general. If you guys have any questions later, we can drill down a little bit further. So.